Lots of concern here in San Diego about possible defense spending cuts. Joining us this morning is Congressman Brian Bilbray. Good morning to you. Thank you for being here.
Great to be with you.
First, starting off on sort of a somber note, we want to get your reaction to the shooting at the Sikh temple in Wisconsin yesterday.
You know, you talk about a sad situation, especially here in America, where, religious tolerance is a foundation of our freedoms. And frankly, I've got to believe that anybody who knows the Sikhs knows that this was obviously somebody who was ignorant of their faith and their beliefs, and just really one of those cruel, stupid acts that sadly happen much too often.
All right, switching gears here a little bit, let's talk about defense spending cuts. Where exactly do we stand on those?
Well, what we stand is that the chairman over in the House Representatives, in fact, both the Democrat and Republican over at what's called HASC, the Armed Services Committee for the House, they have passed an alternative to the across-the-board cut of sequestration. So they've actually worked it out about a better way to be able to stay within the budget and still maintain the military mission. The trouble is you've got the Senate has been absolutely locked up. I mean, they haven't even passed the budget in 3 years. And so we're trying to get the Senate to address this. In fact, I sent a letter to Harry Reid and asked, Harry to specifically address this issue now, because there's all kinds of expenditures going on, getting ready to shut down the military operations, even though we know that at the last minute the Senate will come in, join with us, and work this out. But by law, you've got people in the military who are required to start canceling contracts, canceling procedures, that they're going to start back up once the Senate gets back together and we work this out. So it's a huge waste of government and taxpayers' funds, and it's also really unnerving for those men and women who are over in harm's way trying to serve our country overseas. And
I understand it's really frustrating, too, for defense contractors who say they're going to have to issue layoff notices, and so they need to know, basically.
Absolutely. See, that's the problem. You've got to give out that. This isn't just a government concern. We depend on the private sector for so much of what we assume is a government service, and national defense is no different. And that's why it's really kind of critical that we don't wait to the last minute the way Washington does so often, that we try to be proactive on this. And I've got to tell you something, you've got a chairman and a ranking member on armed services on the House side that really did what I think the American people want to see Congress do more of, and that is don't wait till the last minute to try to correct something. Get it done when you got time to do it right. And frankly, I think Buck McKeon should be really credited with being proactive and not putting it off. And I hope that the Senate finally picks it up and starts doing something with it, because it's actually costing us our national defense and our budget by delaying this.
Let's touch real quickly on the continuing debate over the Bush-era tax cuts. Of course, Republicans want them extended to everybody. The White House want them extended basically for those making under $250,000 a year.
Well, I think that what we're looking at is, just as President Obama said last year, this is not the time to put a tax increase out there at all. You don't want to pull money out of the private sector just as we're trying to get this economy moving, and we're really on the precipice of possible what they call a double dip. No one wants to see that kind of tax hit pull money out of the economy. So we're trying to make sure that we address it. In fact, one of the things we try to do is say to the Senate was that we will come back immediately to work this out for you. So we try to take care of this issue about tax increases now instead of later, just like we're trying to do with national defense.
And we just have about 30 seconds left, but I want you to tell me really briefly about this Bilbray Patient Choice Act.
Well, what it basically does is address the problem that where we see doctors want to give patients the medical benefits of cannabis extracts. And like my daughter, who is a chemo patient, she had to go to an illegal system, or at least the president says illegal system, to try to get the medicine that helped her through chemo. We've got these products, or medicines, actually with the active ingredients overseas in Europe and Canada for over 4 years. My bill says, FDA, quit messing around. Bring this in, expedite it, and get this medicine to patients so they don't have to take, and being forced, like my daughter, to use procedures that are not sanctioned by the federal government. You shouldn't have to go to a marijuana clinic to get the medicinal purpose ingredients of cannabis. You should be able to go to your doctor, get a prescription, and get it at the pharmacy and be able to have that access. I think that there's a real frustration. It's taken this long trying to work it out to where Washington will finally take a look at this and say Democrats and Republicans agree that when it comes to true medical use of cannabis extracts, everybody should be working on this, and especially the FDA should be getting off their delay button and get to the go button, so patients like my daughter will be able to have that access that the physicians say there are practical use for patients with cancer, patients with glaucoma, and many other applications. Then those should be within the legal pharmaceutical system, but it takes the FDA to approve that to stop this logjam. My Patient's Choice Act creates that environment, and I've really seen a lot of great support from people that I would normally call very conservative Republicans to very liberal Democrats. Maybe this is one thing that we can get both sides working together on in Washington, which is really hard nowadays.
Thank you so much for joining us this morning. We really appreciate it.
Absolutely. Take care.
All right, at 7:29.